Hello everyone, you are welcome back to my channel. My name is Dr. Sinana Januma. I'm a medical doctor in Nigeria and I make videos to create awareness about disease conditions and also to promote good lifestyle among people. Okay, today seems to be will I call it, today seems to be a fertility day. I don't know whether it's just a coincidence, but I just saw 3 different patients now and they were all saying, complaining the same thing, okay? Doctor, I have been living with my boyfriend for the past 3 years and I have not been able to get pregnant. I want to know why. Okay, so we discussed some things and I feel like extending the discussion to the general public so that, and because some of the things we discuss are bordering of lack of knowledge. So it's good that you know the right thing and do the right thing so that you get the right answer, okay, and the right result. Okay, so the first person said, Doctor, I have been taking, okay, I asked, for how long have you lived with your husband? She said, I've lived with him for about 3 years. Okay, how often do you meet? And she said, about once in a month. And so that's one thing I want to say. So once in a month is quite insignificant to get pregnant, okay? In that month, you ovulate once, okay? And you can only get pregnant within that ovulation period. Do you understand? And after ovulation, your egg has only 24 hours, just a day to expire, all right? So, and if there's no sperm in your body to, fertilize it, you have missed the opportunity for that month. And the sperm can only last a maximum of 7 days in the female body. Okay, so if there was no sex within 7 days before that ovulation day, and there was no, sex within that ovulation day, so the chances are lost. So the implication is that having meeting your husband once in a month is no. Before we regard your inability to conceive as a problem, you must have met your husband for at least three times every week, okay, and you must meet for like 52 weeks, 1 year, okay? So 3 times every week for complete 1 year, and it must be unprotected, and it must be vaginal, okay? That's one. So two, the other person said, Doctor, I've been taking white quinine to prevent pregnancy, but now I have stopped white quinine. So I don't know where that one is coming from, but quinine is not a contraceptive, okay? It's an anti-malaria, please. Quinine is used in treating malaria. It is not used in preventing pregnancy. In fact, there are so many things to be said, honestly, but I don't know why we do things a lot. So that's that. Quinine is not a contraceptive. Please hear it and hear it now. It is also not an abortifacient. I don't know why. And the problem is most times the people that do this thing, they hold the belief so tenacious that if you like talk from now to tomorrow, they still believe that it works and they keep doing it. Okay. So the other person said, which is the one that I'm much more interested in, she has been taking Beecham Ampiclox for the past 7 years. So I asked her, and then in that past 7 years, she has gotten pregnant about 7 times too. I said, okay, 7 years, 7 pregnancy, even in the midst of your Beecham Ampiclox. She said, Doctor, yes, that's an average of once a year. So that means the Beecham Ampiclox is working. It prevents pregnancy because she takes it every time she meets the boyfriend, and in fact they live together as students. Honestly, first of all, I don't even know. Okay, let's talk about the antibiotics. Antibiotics has a side effect, and that side effect is, number one, is it can make you to become resistant. That when you now get an infection that we need that antibiotics, it will no longer work again. Okay, and it can reduce your immune system, and it can also, and once it reduces your immune system, then the real infection can occur. Okay, Beecham Ampiclox is not a contraceptive. It is an antibiotics. Antibiotics is a class of drug used in treating bacterial infections. Okay, there are so many types of infections. We have viral, we have fungal, we have bacteria. Antibiotics is reserved only for bacterial infections. It is not used in any other thing. It's not used in treating malaria. Some of you used to take amoxicillin for malaria. It is not. Okay? it is not an antibiotic, it's not a contraceptive, please. And then for somebody that has been taking it for 7 years, and in that 7 years she has removed 7 pregnancies, she didn't even care to okay, if this thing is working, why then was I able to get pregnancy for 7 times in 7 years? Okay, to her that's is so infinitesimal, it's so insignificant, but it's significant in the sense that there are other factors that could have played a role for her not to get pregnant, depending on how long she allows each pregnancy to linger before she terminates it. Okay, if you allow the pregnancy to stay 5 months, that 5 months is you're already pregnant, so you cannot get pregnant again. But then she's counting it as part of what Beecham Ampiclox is working. So please let that enter. Beecham Ampiclox or any other brand. The Beecham there is just a brand, okay? There are so many other brands of Ampiclox. So whichever brand you're taking, Ampiclox is an Ampiclox, and it is not a contraceptive. Alright. So in summary, white quinine is not a contraceptive, Beecham Ampiclox is not a contraceptive, and pregnancy is not easy, okay? Meeting your husband or your boyfriend once every month is likely you have a very less chance of getting pregnant, okay? Before we take it as a worry, as a source of concern, and possibly diagnose you of subfertility, you must have met your husband for 3 times every week for about 52 weeks. That's about 1 year. That's not an easy feat. If you do it like this, then we know that something definitely is wrong. Okay, and if yes, excuse me. Yes, come in. Open the door. Sorry, and if it happens, then there's a male factor, there's a female factor. So both the man and the woman has to come, okay? It's not always the fault of the woman. All right, so let me stop here. We'll continue the video later. Thank you for listening. Bye.